In just 1 year, the CDC says more than 101,000 drug overdose deaths happened right here in the U.S. They say over 68,000 of those deaths were from synthetic opioids. From August 2021 to August 2022, North Carolina saw a 4.16% increase in opioid deaths. It's a lot of numbers, but remember, each one is a real person. And amid a national crisis, we're getting an exclusive, up-close look at government efforts to crack down on the illegal trade of fentanyl. Jeff Pugaze was with federal agents as they raided a suspected fentanyl lab, this one run by cartel agents looking to distribute the drugs on U.S. streets.
Before the sun came up, Homeland Security agents gathered ready to raid a Tucson, Arizona home.
Starting to roll.
We were there as they moved in with the help of local police.
Just stay on this side of the marked unit.
Inside they found 100 pounds of what they believe are precursor chemicals or chemicals used to make fentanyl, a drug 50 times more potent than heroin. It's been flooding cities across the country and blamed for thousands of deaths a year. Why is it so hard to stop the distribution?
Because there's so many different ways that it can be smuggled into the United States, right? It's coming in through 18-wheelers, it's coming in through passenger vehicles, it's coming in through people walking across the border.
According to investigators, China is one of the primary suppliers for these precursor chemicals for fentanyl. And look what's written on this box. But it's harder to track because it's being shipped in smaller amounts. How does that pose problems for law enforcement?
They're not going to raise as much suspicion if they're coming in smaller shipments versus a large bulk shipment.
The Mexican cartels are always trying to stay one step ahead of U.S. law enforcement, and what was found in that house may be an example of that, because investigators are still testing the chemicals, but they believe that what was in that house may be a fentanyl lab. And now they see those across the country, but they don't see a lot of them, and that's what concerns them.
Last year, law enforcement seized more than 50 million fentanyl-laced pills and over 10,000 pounds of fentanyl powder. That is enough to kill every American. But there are programs here in North Carolina aimed at helping folks recover from substance abuse. In fact, just last month, the State Department of Health and Human Services awarded over $3 million to 9 colleges and universities across the state. The money will be used to create or expand recovery services and support on campuses for students with substance abuse disorders. Here in the Triad, Elon and High Point University will be using the money to create new programs to help their students. UNCG will expand their current program. Experts say a big reason the opioid epidemic got so out of hand is because a lot of the hardworking, smart, kind people started taking prescription pills that were prescribed by their doctors. They got hooked, kept chasing bigger and bigger highs after that. Now researchers at UNC are trying to keep that from happening to others.
I think this is sort of the first step in many.
UNC researchers teamed up with scientists in China to research opioid receptors and how our bodies react to medicine, sometimes even triggering addiction. Researcher and doctoral candidate Jeff DeBerto published this research in the scientific journal Cell, giving drug developers a structural framework for creating safer, less addictive medicines.
What our research is trying to do is figure out ways where we can influence the way that receptor talks to these other proteins and only talks to those that are therapeutic.
At first, I never knew I was going to be depending on you every day, and that I wouldn't be able to walk away from you if I wanted to.
Danette Jerringen read this letter her daughter Dakota wrote about her drug addiction. Dakota died of a fentanyl overdose nearly 4 years ago. Since then, Mom has worked with a group called Joko's Angels to help those fighting opioid addiction. She's glad to see scientists trying to help in the fight.
And it is something that can give us all a little bit of hope that the problem will have a little relief.
While drug companies will have access to the research, scientists say it could take several years for those companies to get improved medicine approved and in the hands of patients. In the past years, there have been several lawsuits against pharmaceutical companies claiming they played a big role in the opioid epidemic. Some of those companies have settled their lawsuits, leaving counties like Guilford funding to create programs to educate about and help resolve the drug crisis. Now, to get those funds out to where they need to go, the Guilford County Health Department created a new role, a drug and injury prevention manager, to decide where that will go.
I'm excited to see what's in store. I've only been on the job for about 2 weeks at this point, so I really don't know exactly what this is going to look like yet. So we're going to be building this airplane while it's flying.